Because we infrequently have patients with opioid use disorder, and we've just recently started using the MNO folder, I wanted just to discuss and explain what the purpose of the folder is. Stapled to the front of the folder is a paper titled How to Use This Folder, and it lists what is contained within the folder, and there's more description on exactly how to use it. When the nurses in labor and delivery are admitting their patient, they ask 5 questions, which are called the 5 Ps. If the 5 P screen is positive, then the nurse will obtain the MNO folder, which is held in Michelle's office, and start using the MNO nursing workflow sheet. This form should remain in with the folder and be given to the mother-baby nurse at transfer to postpartum. Below are the questions that are contained in the 5P screening, validated screening tool. If the patient screens positive, then the nurse will alert the provider of the positive 5P screen and provide this SBIRT algorithm. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. And as you can see here, it goes through all the different things that should happen with the patient while she's in the hospital. There also is a consultation guideline sheet. Some of these things are really better done in the prenatal office, but as you go further down in the sheet, it describes things that we need to address during their hospital stay. There is a nursing workflow checklist, which really will help guide you when you're caring for these patients, similar to how we use the bereavement checklist to make sure that we don't leave any things undone. There's a labor and delivery side, and then there's also a postpartum and discharge side. Once the patient gets to mother baby, the nurse will give the folder to the patient and review the information that's within the folder. Keep the nursing workflow sheet and the sheet on top that says how to use this folder with the Cardex. Give the newborn care diary to the parents so that they can fill in the INO and the infant sleep and comfort routines. And then the discharge sheet will be filled out collaboratively with the patient, family, RN, social worker, and physician. The provider should review the Save a Life material. The Save a Life material describes why Narcan should be prescribed for any patient with opioid use disorder. There is a Narcan rescue kit checklist that describes how to use the Narcan. Here's just the top part of the Save a Life. And as you see here, overdose is now the leading cause of death for pregnant and postpartum women in Illinois. And so we really want to address that. When I spoke to the residents the other day, I suggested that because ILPQC suggests that anytime any kind of opioid is prescribed, that Narcan is also co-prescribed, just in case anyone overdosed on the opioids. There's a welcome letter, a congratulation letter, and this describes how the parents are really the most important treatment for their baby. And this relates to really encouraging people to hold and skin to skin, breastfeed if that's applicable for this particular, depending on what their substance use is, and it really helps them understand that we are not holding any kind of judgment around the care of their baby. There is a pamphlet in the folder that describes neonatal abstinence syndrome, so the parents will be aware of the kind of things that they might observe in their baby. This is the top row of the newborn care diary, so the parents will fill in the time that the infant fed, if they were breastfeeding or bottle feeding, when the baby fell asleep, what time the baby woke up, how well did the baby eat, did the baby sleep for an hour or more, How about consoling? Was the baby able to be consoled in 10 minutes? And then we have one for wet and dirty diapers. There also is a sheet in here about prescription pain meds, opioids, and pregnancy. And of course, now they're already done with their pregnancy, but it still is a good description of opioids. There is also another like 2 or 3 pages about birth control. This is a discharge checklist, and there's discharge criteria. There's several pages of this form. And then the coordinated discharge worksheet. This is something that the patient can work on herself and write down what supports she currently have. As you go through this, look through over this sheet, there's a lot of things that she can participate in. When we first started talking about implementing MNO and in the CBTs, we talked about utilizing the Eat, Sleep, and Console screening tool. We are going to use that, but the NEOs also want us to continue using the neonatal abstinence screening so that we can compare those two techniques of screening.